We didn't really start with clear research questions. We started with objectives, and we started with challenges, and we started with responsibilities. The purpose wasn't the research, the purpose was to improve the outcomes.
Jamie, how would you describe some of the work that you do in global public health?
It's a little bit complicated. We have a number of projects. We have probably 35 projects around the world, but each of the projects has a particular public health objective. It could be improving immunization for newborns or infants. It could be to provide better care for delivering mothers. It could be HIV prevention. And our role in each of those projects is to understand what is it that needs to be done, what are the best ways of doing that, and then trying to implement it and looking at how well it's working.
You've committed, Jamie, to working in communities in many challenging contexts and often in places that have some of the poorest health indicators. Are there parts of your work that you are most proud of, or that you can look back on and see them as really critical or impactful?
The first project we had wasn't a research project. It wasn't a sort of a typical academic project. It was a project which had very specific objectives around preventing HIV, and particularly preventing HIV for people who are most vulnerable. When I started in India, I felt very daunted, very overwhelmed. India is such a big and complicated context, and for somebody who's been working in public health in a small province in Canada, it's very daunting. But what I realized is that if you bring together a good team, together you can start to solve things. Over the years, I've been able to develop and work with really, really talented teams. I keep on telling everybody it's the best global health team in the world, and I really think that's true, and I think I'm not the only one who thinks that. But I think the opportunity and the ability to build a team is probably the most satisfying part of my work in this area.
The work that you've done has had such an impact on global health that you've been sought after as a leading global health researcher, yet the University of Manitoba has remained home for you. You created a Center for Global Public Health, which has now become an Institute for Global Public Health, and really firmly put the University of Manitoba as a leader in global public health. Tell us why the University of Manitoba has been the right place for you.
What I realized, having interacted with a lot of the other major universities in global health, was that what we had here was an environment. It was much more conducive to the way that we did global health, which was collaborative, it was in partnership, it was very oriented around programs rather than purely academic achievement. And I think that it's been exemplified when you look at the amount of confidence an organization like the Gates Foundation has had in us over the years. And I think that it's because they recognize that we have something that's unique. We kind of blend the commitment and the accountability with the expertise and the rigor that an academic institution brings. And I think that's been something that I don't think there's very many other places that would provide that mix.
Jamie, the impact that you have had on global public health has been transformational. And you've done all of it with humility and in partnership. And I can think of no one more deserving than you to receive this award.
Thank you, Marissa.